Gynecology for seniors, what you need to know. This video is for informational purposes only and should not be used in place of the advice of a medical professional. To maintain good health during the senior years, it's essential that senior women continue receiving gynecological care tailored to their specific needs. Understanding the aging process in women. As women enter their senior years, their bodies experience significant changes, particularly in reproductive health and hormone balance, which can affect overall well-being. Preventative care. Gynecological health remains crucial for women as they age, with a focus on screening, symptom management, and maintaining quality of life. Your preventive health care should include discussions with your healthcare provider about screenings for cervical and breast cancer, managing common symptoms such as hot flashes and vaginal dryness, and understanding the risks and benefits of hormone replacement therapy. It's also critical for older women to stay informed about their sexual health and treatment options for common conditions such as urinary incontinence and pelvic organ prolapse. When considering gynecological care for senior women, pelvic exams and breast exams remain crucial, especially considering risks of cervical cancer, breast cancer, uterine cancer, and ovarian cancer. If you're a woman in your senior years, you should be aware of the importance of these exams, as they play a role in early detection. Cervical cancer screening. After 65, many women may not require an annual pap smear if they've had normal screenings for the previous decade. However, your primary care physician may recommend continued testing if you have a family history or if you've had previous abnormal tests. Breast health. Between mammograms and manual breast exams, screening should continue as breast cancer remains a risk. Discuss with your healthcare provider the frequency of these tests based on your medical history. Menopausal symptoms. Issues like vaginal dryness, hot flashes, and night sweats can be common. Hormone replacement therapy may be an option for some, while others may benefit from non-hormonal treatment options. Vaginal and urinary tract health. Vaginal discharge, urinary tract infections, and urinary incontinence can affect older women. Maintain regular visits to address these issues and learn about effective management strategies. Bone health. Discuss bone density scans with your doctor, as your risk for osteoporosis increases with age. Monitoring chronic diseases like diabetes and high blood pressure becomes imperative. They can have an impact on your gynecological health and may lead to increased risk of heart disease or exacerbate menopausal symptoms. Common gynecological issues in seniors. Urinary tract infections and incontinence. Urinary tract infections, UTIs, are more prevalent in older women due to changes in the urinary system. Urinary incontinence, the involuntary leakage of urine, can also be a concern, often stemming from weakened pelvic floor muscles, and can significantly affect daily activities. Pelvic pain and prolapse. Pelvic organ prolapse, where the pelvic organs drop due to weakened muscles, can lead to a feeling of pressure or fullness in the pelvic area. This condition is closely associated with incontinence and bladder leakage. Vaginal atrophy and painful sex. Vaginal atrophy occurs due to decreased estrogen levels, leading to thinning of vaginal walls and decreased vaginal lubrication, which can result in painful sexual intercourse. It's crucial for senior women to have an open dialogue with their healthcare provider about any signs of vulvovaginal inflammation, vaginal discharge, or pain during sexual activity, as these may be indicative of underlying health concerns that require medical care. Cancer awareness and management. Your health as a senior woman should include awareness and management strategies for cancers pertinent to your age group, such as cervical cancer, breast cancer, and uterine cancer. Regular screenings and understanding the symptoms are crucial for early detection and treatment. Understanding cervical and breast cancer. Cervical cancer. Regular pelvic exams and pap tests are important as they can detect precancerous conditions of the cervix. If you are over the age of 65 and have had normal pap test results for several years, or if you have had your cervix removed during a hysterectomy, for reasons not related to cancer, you may not need screening, but consult your doctor and follow his/her recommendation. However, if you're still sexually active or have a history of cervical cancer or precancerous conditions, your doctor may advise continuing regular screenings. Key screenings. Pap test should begin at age 21 and follow your healthcare provider's guidelines for frequency. HPV test, possible requirement, especially if you've had exposure to HPV, which is an independent risk factor for cervical cancer. Breast cancer, mammograms should be a key part of your healthcare routine. Breast exams, either performed by your physician or through self-examinations, are also important for noticing any changes in your breast tissue. Risk factors include age, the risk increases as you get older, family history. If breast cancer is recurrent in your family, discuss the appropriate screening schedule with your healthcare provider. Hormone therapy, especially estrogen replacement therapy, which can be associated with breast cancer development. Uterine cancer, risks and symptoms. Uterine cancer often presents symptoms such as vaginal bleeding after menopause, abnormal discharge, or pelvic pain. It's essential to report these symptoms to your healthcare provider promptly for further investigation. Risk factors, age, it's more common in women over 50 years of age. Endometrial hyperplasia, a condition characterized by thickening of the uterus lining, which can increase the risk of developing uterine cancer. Obesity, being overweight can produce more estrogen, which can heighten the risk. Treatment options and hormone therapies. As you navigate the senior years of women's health, understanding the various treatment options, particularly hormone therapies, is crucial. These therapies are tailored to alleviate symptoms associated with menopause, such as hot flashes and vaginal dryness, while also addressing long-term health concerns linked to decreased estrogen levels. Hormone replacement therapy pros and cons. Pros: alleviates menopausal symptoms, may reduce the risk of osteoporosis and fractures, can improve vaginal health and alleviate urinary tract symptoms. Cons: increased risk for certain conditions, such as blood clots and breast cancer, risk of endometrial cancer if estrogen is taken without progesterone, potential side effects, including nausea and bloating. It's essential that you discuss your personal and family history with your primary care physician or OB/GYN to weigh these factors, especially if you have a history of heart disease, breast cancer, or are at risk for gynecological cancers. Alternatives to traditional hormone therapy. Lifestyle changes, implementation of dietary changes, regular exercise, and stress-reducing practices such as yoga can have a meaningful impact on symptoms. Non-hormonal medications, treatments like low-dose antidepressants can mitigate hot flashes, while medications aimed at strengthening bone density can be a preventive measure against fractures. Vaginal estrogen, to specifically target vaginal dryness and related discomfort, local estrogen treatments are available in the form of creams or rings. Frequently asked questions. Is there a recommended age for women to cease gynecological examinations? There is no set age for women to stop gynecological examinations, as individual health needs can vary. Women should discuss with their primary care physician or OB/GYN to make a personal decision based on their overall health, medical history, and family history. It's important to continue these health visits, as they play a crucial role in the early detection and treatment of gynecological problems. How often should senior women schedule gynecological exams? Senior women should continue to have gynecological exams on a regular basis, at least annually unless advised otherwise by their healthcare provider. These exams are important for monitoring changes in the pelvic organs, screening for cervical cancer with a Pap test, and evaluating any symptoms like pelvic pain or urinary incontinence. How can seniors find a gynecologist specializing in geriatric care? Ask for referrals from primary care physicians, check with local healthcare networks, and ensure the selected gynecologist has experience in geriatric gynecology. Conclusion: in your senior years, maintaining good health becomes paramount, and gynecological care is no exception. Regular health screenings, including a pelvic exam and a breast exam, are vital for early detection of conditions like cervical cancer and breast cancer. Thank you for watching. To read the full article, go to livingyourseniorlife.com. The link can be found in the video description.